So hundreds of thousands of Americans have sought some type of medical care for post-COVID health problems that have not been diagnosed before they became infected with coronavirus. That's according to the largest study to date on long-term symptoms in COVID patients. So Dr. Berger, I want to start with you. What are you seeing?
Well, we're definitely seeing the number of kids that are wonderful, but we're still seeing them. During the pandemic, we've seen kids that are coming in with COVID that have no symptoms, maybe just had a contact, just kids that are having mild to moderate symptoms. But what I want to stress is that it's low risk to kids, but it's definitely not no risk to kids. What we've also seen, and as you've alluded to, that there is something that we call long COVID, and that we're seeing it not just in adults, but we're seeing it in children. And the symptoms that we're seeing are fatigue, achiness, headaches, insomnia, and then more commonly, respiratory issues, palpitations. They're presenting with exercise intolerance. And we're also seeing a psychological component with anxiety and moodiness, more so than the general teen moodiness. But it's real stuff, and we're definitely seeing and we're dealing with it now, not just in adults. We're seeing it in the pediatric population.
And I think what's interesting too is when you take a look at the data that's out there, not all of them had, those worst cases of COVID or in any event ended up in a hospital or anything like that. A lot of them were asymptomatic.
Absolutely. So we heard early on, before we even heard of long COVID, we heard early on back in June something called MISC, multi-system inflammatory syndrome in children, where we were seeing kids that had maybe a mild or infection, or maybe had the infection and weren't even showing symptoms, and then 2 to 6 weeks later were having chest pain, chest tightness, swollen hands, swollen feet, red eyes, red mouth, some GI symptoms, and then some of them progressed to really multi-system inflammation, winding up in the hospital. We had a few cases in our own practice. A cute little kid who was 6 years old wound up in the ICU. One of the first cases in New York, while we were still the epicenter of the pandemic. He was intubated in the ICU. Thankfully, over the preceding months, he did very well and he's doing well now. We had another beautiful girl, 11 years old. She actually had some underlying issues that we discovered later. We didn't even know it at the time. Same thing, wound up in the hospital on pressors, support for her cardiac system, and is still dealing with the consequences now and is not yet recovered